Hello friends, welcome to my YouTube channel, The Ocean of Medical Literature, and this is my first video, and today we are learning about the heart anatomy. Heart, it is a vital organ in the human body. So today first we will see about the introductory part. In that we will see the introduction of the heart. So as you know, heart it is a conical hollow muscular organ. Okay, it is a vital organ and it is a hollow. Hollow means the part which is empty from inside. So that is a hollow muscular. Why it is called as a muscular? Because muscular, it is made up of the cardiac muscle fiber. So that is called as the hollow muscular organ. Okay, hollow muscular organ. Now this is a hollow muscular organ, but where it is exactly in the body? So it is situated in the mediastinum. What is the mediastinum? Mediastinum, it is a place where the heart is situated. It is the place between the two lungs. Okay, it's called as the mediastinum. 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 It is the place where the heart is situated. Enclose the pericardial sac. Okay, so mediastinum, it is the place where the heart is situated, and heart it is situated enclosed in the pericardial sac. Pericardial sac. Okay, so now we will see what is the Greek name for heart. In the Greek name for heart is known as cardia. So from cardia, the word is known as the cardiac, cardiologist, cardiophysician. It is from the cardia, and cardia what is a Greek word, and in the Latin language it is known as cor. C-O-R. So from cor, the word is called as coronary. So that is a two name, that is cardia and core, which is known as the heart. Now what is the main function of the heart? Heart main function is pumping blood to the various part of the body. Okay. Now why it's pumping? Because blood contains very nutritive substance which is required for our body, which is supplied through the blood, and main function of heart is supplying and pumping the blood. Okay. So function: nutritive supplement. Okay, so it is a function, nutritive supplement and blood pumping. Okay, it is the main function of the heart. Okay, if it is asked in the examination, so you must have to write the introductory part, that is the heart shape, where it's situated, where is the place of the heart is situated, what is the function, what is the Greek and Latin name. Measurements of the heart, it is very important for everyone to know this topic. Measurements. In the measurement, there is a length of heart is 12 by 9 centimeter. It is the length of the heart. 12 length and 9 centimeter is the breadth. So that is the 12 by 9 centimeter in length. And weight, if you see weight, there is a 300 gram in male and 250 gram in female. Okay, so measurements of the heart. Heart is situated obliquely at mediastinum, just behind the body of sternum, where the joining part of the costal cartilages. Okay, and its measurement length is 12 by 9 centimeter and weight is 300 gram in male and 250 gram in female. Okay, so here we already done with the introductory part of the heart anatomy. Now the very important, and in many time in the examination it will frequently ask question, that is the external features of the heart. external feature of the heart is very important. So first we will see theoretically. There is some points which is come under the external features of the heart. Now and then we will see diagrammatically, and then you will easily understand what is the external features of the heart and what are the points under that. Okay, so in the external features of the heart, first we will see the groove. Grooves. Now what is the groove? In the heart there is a three types of grooves. So grooves, it is the just imagine there is a two things is just joining at one point, and the point where exactly the nali like structure is formed and something little bit deep structure is formed, it is called as a groove. So in the heart there is a three grooves. Okay, if you see there is a three grooves. Okay, there is a three groups you can see. Okay, so first group is known as atrioventricular. Atrioventricular group. Second is interarterial group. Interarterial group, and last one is interventricular group. Okay, so this main three group, there is a atrioventricular group, interarterial group, and last one is interventricular group. Now what is exactly that? If you see, just see the diagram of the heart. Okay, just imagine this is a heart. In the heart there is some groove like that. Okay, so if you see this part, just this part, upper part, it is known as interarterial groove. Okay, because atrium is there. Okay, the upper chamber of the heart is known as atrium. Just between the two atrium there is a groove is known as interarterial groove. Okay, and if you go down there is a ventricles. Okay, there is a two ventricle. Just between the two ventricle there is known as ventricular groove. Okay, interventricular groove. Interarterial groove, which is between the two atrium, and interventricular groove, which is between the two ventricles. Okay, and if you see the atrioventricular groove, atrium for atrium, ventricular for ventricle, between two upper atrium and two lower ventricle, the groove, this groove is known as atrioventricular groove. Okay, so there is a three types of groove: interarterial groove, interventricular groove, and atrioventricular groove. Understand? Then we can see this groove is present anteriorly. Okay, if you see the heart posteriorly, there is also the groove known as posterior groove. Okay, it is also you can say the subdivision of this groove. Okay, so anterior structure of the heart containing these three groove, and if you see posteriorly of the heart, there is also this groove same. Okay, so you can say anterior and posterior. Okay, the anterior means front of the heart, posterior and back side of the heart. Okay, so that is the first external feature of the heart, that is a groove. Okay, in the examination it's maximum time asking for the 7-mark question, so you have to write okay this groove. Then we can see the next feature, apex. The next external feature is apex. APEX, apex. Okay, apex of heart, it's very important topic. Apex of heart is directly downward. Okay, directly downward of the heart. If you see, it is the heart, okay, and it is known as the apex of heart, okay. Apex of heart is mainly formed by left ventricle. Left ventricle, okay. Left ventricle is formed apex of the heart, and apex of heart is downward and just slightly going to left side, downwards left side, okay. So apex of heart, it is the second external feature which you have to write in the examination, okay. So third point of the external feature of the heart, that is the base of the heart. So if you see, the base of the heart is mainly formed by the posterior surface, okay. Posterior surface of the heart is formed by base, okay. If you see posterior surface, in the posterior surface also, the maximum part of the base is formed by the left atrium, okay. Left atrium is mainly from the base of the heart, and just small, means you can say 1/3 part of the base is formed by the right atrium, and 2/3 part of the base is formed by the left atrium, and 4 pulmonary veins also part of the base of the heart, okay. So if you want to write, so you can see posterior surface containing 1/3 part of right atrium. RT means right atrium, and 2/3 left atrium, and 4 pulmonary veins, okay. We will see diagrammatically these surfaces and this part, okay. When we see the posterior surface of the heart, then I will show you the base of the heart. So base of the heart is formed by the posterior surface, in that 1/3 right atrium, 2/3 part of the left atrium, and 4 pulmonary veins. It's formed together base of the heart. So next point of the external feature of the heart, containing crust. Crust of the heart is it's very simple. If you see, many people come at the one point, meeting point, okay. So in same heart also, where all the groove, all 3 grooves we see, there is a 3 groove. So meeting points of the all 3 grooves, meeting point, okay, grooves, all grooves meeting point is known as crust of the heart. Means, see, if these 3 are the grooves, so in the center there is a crust of the heart. So meeting point of the all 3 grooves is known as the crust of heart, okay. It's very simple. Then we can see, then third last very important point of the external feature, that is the surfaces. Surfaces of the heart, okay. It is a very important point. And heart surfaces, there is a 3 heart surfaces. So we see first 3 diagrammatically, then I will show you in the next video diagrammatically where exactly the surfaces of the heart. So see here, okay, there are 3 surfaces. First is called as anterior surface or sternocostal surface. Anterior surface or sternocostal. That is the one surface. Anterior means front of the heart. That is called as anterior. Or intercostal surface. Why it is called as? Because if you see in front of the heart, there is a sternum bone. Okay, sternum and the intercostal muscles, cartilages there. That is called as sternocostal or anterior surface. Next, we can see the inferior surface. Inferior means downward side, just below of the heart. There is a one surface called as inferior. Downside, it's known as the inferior surface. We will see in detail also. So first we will see anterior surface or sternocostal surface. Second is inferior, means downward of the, and last one is the left lateral. Okay, so these three: anterior surface, inferior surface, and left lateral. Lateral means lateral side of the heart. It's known as the lateral surface. Okay, so left lateral. So these three surfaces I will show you in diagram also and in detail also. Okay, left lateral, inferior, and anterior and intercostal surfaces. Okay, then next point of the external features of the heart containing border. Okay, border of heart. In that there are 4 types of the border. Okay, if you see, there is upper border, upper side of the heart. I will show you in diagram also. It's known as the upper border. Then next one is the inferior, downwards. That is known as the inferior border. Upper, inferior. Next one is the right side of the heart is known as the right border. Left side of the heart is known as the left border. So there are the 4 borders. Okay, I will show you in diagram also, and I have the heart model also. So I will show you on heart model also. Okay, we will see the external feature, and then after the border, the last point of the external features of the heart is known as the types of circulation. So last point of the external features of the heart containing types of the circulation. Okay, the main function of the heart, we know the circulation to all parts of the body, but heart itself also types of the circulation. Okay, so we can see the systemic circulation, and next one is the pulmonary circulation. Okay, under that systemic circulation, it is a very simple topic. Very simple. I will explain you in the trick diagram also, so you will understand easily what is the systemic circulation and what is the pulmonary circulation. So in the systemic circulation, it is start from left ventricle to right atrium. I will explain you in detail also. So from left ventricle to right atrium, the circulation is known as systemic circulation. And in the pulmonary circulation, from left ventricle to the right, from right ventricle to left atrium, the circulation is known as pulmonary circulation. I will explain you in detail why it is called as a pulmonary and why it is called as a systemic. Okay, it is a very simple topic. So we can see in the next video detail of the all external features of the heart in detail, in diagrammatically also, and on heart model also. So please like, subscribe my channel, and if you like the video, so share more and more. Thank you.